Now let's talk about concept of the hernia repair. So we said hernia is a weakness or a defect of abdominal wall, right? So if you have a hole in the abdominal wall, the easiest way to do it is to close it primarily with the sutures. So sometimes in some of the areas, you'll be able to do that without having any trouble. For example, if you have around the belly button, the defect or even in the mid-abdominal wall or even diastasis recti, you'll be able to primarily close them with the suture and bring the muscle together and close the defect or weakness. Now, sometimes we reinforce the closure with a piece of plastic called mesh to reinforce the closure. That mesh create a foreign body reaction. Your body makes a scar tissue which grows into the to the mesh, which is created like a little window screen, and those holes fills up with the scar tissue, and that piece of mesh basically incorporates to your abdominal wall and reinforce the closure, make it very, very firm and thick tissue so it can prevent hernia to come back. But in some areas, for example, in the groin area, you cannot bring the muscle back together, or it's going to be very, very difficult or more dangerous, or cause more trouble and pain and discomfort for patients after the surgery. One of the reasons is in that area, the muscles are very tight. You cannot bring the muscle to the ligaments without any tension. And also there are very main structures like blood vessels and nerves in that area that you can cause trouble by putting sutures into that area. So those defects usually patch them with the mesh. So we patch the hole closed. So if you have the hole, you bring the mesh and place it whether over the top of the muscle or behind the muscle, and then again it creates a foreign body reaction, and then the mesh will incorporate into the muscle, and that way you fix the hernia. Sometimes, especially in the abdominal wall area, the hernia defect is extremely large, and you cannot bring the muscle back together with regular sutures without creating a lot of tension in the abdominal wall. In those type of patients, we basically create muscle flap. With a different technique, we bring the muscle flap and bring them closer into the center to reconstruct the abdominal wall muscle in the front, and then we reinforce that with a large piece of mesh, again from the top of the muscle or behind the muscle, depending on the technique that we use. But essentially, the hernia can be closed primarily with a suture, and sometimes if the defect is very small, we don't necessarily need to use the mesh, especially for people who have a very strong muscles and the defect is very small. You bring the muscle nicely without any tension together in the center with the suture. You don't necessarily need to reinforce it with the mesh, but if the defect is large, if the muscles are weak, the patient is very old and they don't have they have a lot of tension in the middle after you bring in the muscle together, then we need to reinforce that with the mesh. In the groin region, most of the time, more than 99% of the time, we use the mesh to patch the hole close.